So you're a patient and you have a wound that's not healing at all. Or you're a clinician and you're trying to treat or heal a wound, but the wound is not improving. Did you know that some wounds don't heal? It's not because they are serious, but because of three common things people overlooked. Number one, poor circulation. A wound heals with oxygen and nutrients delivered by your blood. So if circulation is weak, like in diabetes, swelling, or vascular disease, healing slows down no matter how good the dressing is. Number two is letting the wound dry out. Contrary to popular belief, scabs actually slow healing. Most wounds heal faster in a clean, moist environment. That's how skin cell migrate and close the wound. This is precisely the reason why dressing selection is very important because we need to cover the wound. So the guiding principle that I want you to always remember is dress for success. You're not just gonna put a dressing there because somebody told you so, or the dressing looks fancy, or the dressing looks expensive. There has to be always an indication. Okay, you are not only going to dress because you just want to cover your body, right? I'm just making some sort of humor in here, but the clinical humor that I want to say is always dress for success. If you're putting something in there to cover the wound, there has to be an indication. If the wound is dry, you put a dressing that could donate moisture. If the wound is too wet, you have to put something that is absorbent. If the wound has a lot of bioburden, you have to put something that controls that bioburden. So if the wound is, what else? Has some sort of smell that it's affecting the morale of the patient, put something that could control the odor of the wound. So there's always some sort of indication. It's not because your ancestors has told you or your predecessors has told you or mentor has told you, you know what, in this facility you are new and I've been here for the last 30 years of my adult life and we have been using this. This is the way we treat wounds. So it's not like that. There has to be an indication. I'm talking to you if you are a clinician watching this. However, if you are a patient, you have to talk to your clinician. You have to make sure that you always open a good conversation on what type of dressing should you be using, especially if you know that your wound is not moving forwards towards the direction of healing. The other thing that I want to point out is some order says, or sometimes we clinicians, we make an order and let the doctor sign, right? And we're going to say, put this, blah, 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 apply this dressing until healed. Come on. if you are, if you see that order, if you're still making that order, better think otherwise. Until healed. So don't we realize that the wound undergoes different phases of healing, like hemostasis, inflammation, proliferation, and maturation. So therefore, the appearance of the wound is varies, right? So if you're using addressing from this point to that point, you're gonna make the wound to get stuck or stall at at a certain stage or phase of healing. You need to always modify and take a look what's in there. What tissue are we looking at? Are we seeing devitalized tissue that needs to be removed? What kind of exudates are we looking at? Is it still purulent? Is it serous? Is it sanguineous? Okay, it has to match what's the appearance or the characteristics of the wound. That is the reason why when I see well, I work in an outpatient clinic, so a lot of patients have been there for some time. They were seen by a lot of places already, and sometimes the wound didn't didn't close. And one of the reason why I'm talking and emphasizing this, because sometimes there is wrong something wrong in the treatment. Ladies and gentlemen, please don't get me wrong. I'm not telling you. I'm not here to tell you that what I'm telling here is gospel truth, but I see it every day. So how would a wound heal if you are say for example, you are using a dressing that debrides. Okay, say for example, there's a lot of necrotic tissue, slough, and everything. It's okay for you to use a dressing that enhance, or an ointment that enhance the autolytic debridement process. But when the wound starts to granulate, okay, now the wound now has move to the next phase of healing, which is the proliferative phase. You're now seeing the granulation tissue. You're now seeing, you have to put something that supports that phase. Otherwise, you'll be scrubbing off, you'll be sloughing off all those all the cells or the tissues that your body is trying to produce. So that is only one example. It's a little bit complicated, guys. So it's, well, I will not say that because it's common sense. I think this is the better term. Not complicated, but it has to be common sense. Okay, so why would you use a hydrogel dressing, from the very start until the end? So don't, what you're trying to promote, that is the reason why at the middle of your treatment you uh, you uh, you the wound will get infected because you provided a good environment for colonization to happen, instead of trying to favor an environment which is reduced in bioburden. You promoted that if you have been placing something that is moisture donating in otherwise weeping wounds. So in other words, ladies and gentlemen, so an order that says use this dressing until healed must go. Okay. Anyway, peace. Number three is pressure or edema. So let me explain to you why swelling or edema and pressure prevent wound healing. Many people think a wound isn't healing because of the dressing or ointment, like what I said earlier. But very often, the real problem is swelling and pressure. When an area stays swollen, the fluid that builds up is not just water, it's lymphatic fluid that contains inflammatory chemicals and waste products. So chronic edema is always inflammatory. So if you are a clinician taking care of a wound, guys, always remember that the edema, the fluid that contains there that is being retained is always pro-inflammatory. So that trap fluid keeps the tissue in a constant state of inflammation. So the body stays stuck in the first phase of healing, or let me say the second phase of healing, which is the inflammatory phase, and can't move forward throughout the repair process continuum. So swelling also squeezes tiny blood vessels, including oxygen and nutrients delivery. I mean, reducing oxygen and nutrients delivery. Without good blood flow, healing slows down. Pressure makes this worse. Pressure works like stepping on a garden hose. Blood can't get through. So when swelling and pressure are present together, the skin becomes fragile, wounds reopen easily, and healing stalls or even goes backward. That's why real wound healing isn't just about what you put on the wound. It's about controlling swelling, reducing pressure, and restoring circulation. I always tell my colleagues that it's not all about what you put there. It's also about what we can get out from there. So, or take out from there. So like edema, swelling, necrotic tissue and the like, but that's not the concern about today's topic. Okay, I'm just dealing with the three reasons today. I'm not even talking about the vitalized tissue or the necrotic tissue. Okay, now always remember, ladies and gentlemen, that healing starts when inflammation goes down and blood flow goes up. No circulation, no healing. Control the swelling, protect from pressure, and healing can finally begin. I hope you are learning something today. If you there's a lot of technical, I think I said a lot of technical terms today. If you're a layman watching this and there are things that you did not understand, feel free to message me or comment below. If there's a will, there's a way, especially in comes with regards to our health. God bless.